A conversation at a clinic. Conversation between the receptionist and the patient.
Good afternoon. Myself Ash. I have an appointment with Dr. Samuel at 4 o'clock.
Good afternoon, miss. Let me check that for you.
Sure.
I see you have an appointment, but...
But what? Isn't he available right now? It is 4 o'clock.
That's not the case. He is very much in the clinic, but before you, he has to attend 2 other patients. You will have to wait for an hour more.
Oh, that's not fair. Since this appointment was coinciding with my classes, I actually had to bunk them today.
I understand. I apologize for the inconvenience caused. Meanwhile, why don't you relax in the lobby and grab a cup of coffee there?
No thanks. I am good.
Perfect. I will call you once the doctor is done with the 2 patients.
Thanks. And I'm sorry for my behavior. I didn't mean to be rude.
No worries. Please wait in the lobby until I call you.
Sure.
Miss Ash, you may go in now. Dr. Samuel wants to see you.
Great, thanks. Good afternoon, Doc.
Hey. Good afternoon, Miss Ash. How are you? I'm seeing you after a long time.
Yeah. Since I was fit and fine till yesterday. I didn't bother to see you. But today I'm unwell, hence thought to show up.
Ah, never mind. Tell me, what's bothering you?
I have a bad stomachache and almost lost my appetite. Also feeling quite weak.
Oh, you sound terrible. Let me examine you. By the way, what did you eat last night?
Yesterday I had been to a movie with my friends. Later, we all had pepperoni pizza and cold drink. That's all.
Okay. Did you puke any time?
No. But get that feeling almost every time. Therefore, I am unable to eat anything.
Nothing much to worry about. I suspect it's a case of food poisoning.
Oh my God. What should I do now? I have my papers after 2 days and I'm feeling so unwell.
Don't panic. Simply follow my prescription. Tomorrow you should be fit and fine.
Are you sure?
Absolutely. Take these medicines and consume them as per the instructions in this note.
Okay, noted. And what else?
Take this powder. You need to add 1 tablespoon of it in a glass of water. Stir it well and have it. This way you need to have 4 doses today and 6 doses tomorrow.
I get that.
Drink plenty of water. And put yourself to complete rest. And by tomorrow evening you will be perfectly fine.
Simple conversation between doctor and patient about headache.
Hello, what can I do for you?
Good morning, doctor. I don't feel good.
Open your mouth. Since how long are you not feeling well?
Since yesterday.
No problem. Did you have motions yesterday?
No, doctor. Not so freely. I feel weak and do not feel like eating.
Okay, and what else?
I feel like vomiting.
Do you drink a lot of water?
No, doctor, I don't have water too much.
Did you take any medicine?
Yes, doctor. I took a pill of painkiller.
Why did you take it?
Because I felt a headache.
You've a running nose. Looks like your headache is a result of sinus infection. I'll prescribe an antibiotic to clear the infection and a pain reliever to relieve the pain.
Thank you, doctor.
Simple conversation between doctor and patient about fever.
Good morning, doctor.
Good morning. You seem pale, and your voice sounds different.
Yes, doctor. I'm having a temperature. And even a sore throat.
Let me check. Temperature is not too high. Let me check your blood pressure as well.
Okay.
Your blood pressure is fine. Let me check your throat. It seems a bit scruffy. Not good.
Yes. It has been quite bad.
Do you sweat and shiver?
Not sweating. But I feel slightly cold when I sit under a fan.
Okay. You have few signs of malaria. I would recommend you undergo a blood test. Nothing to worry about. In most cases, the test comes out to be negative. It's just careful, as there has been a spurt in malaria cases in the last month or so.
Okay, doctor.
I am writing 3 medicines in syrup. The number of dots in front of each medicine name tells you how many times in the day you have to take them. For example, the 2 dots here mean you've to take the medicine twice in the day. Once in the morning, and once after dinner.
I understand.
Do you have any other questions?
No, doctor. Thank you.
Conversation between doctor and patient about joint pain.
Hello, doctor. Good morning.
Good morning. Have a seat. Please tell me what happened.
For the past few months, I have been experiencing a severe pain in my knee whenever I stand up or walk long distances.
Let me check. Yes. It is slightly swollen, but probably nothing is broken. Can you please stand up for me?
It really hurts when I try to stand after being seated for a while.
Did you fall down or hit your knee somewhere?
No, doctor, as far as I remember. I didn't hurt my knees.
Okay. So I'm giving you ibuprofen. It will help bring down the swelling and pain. Once the swelling goes down, you can take some tests which will help me judge why you have this constant pain. Have the medicines for 2 days. And come back for another checkup once the swelling is gone.
Sure, doctor. Thank you.
You are welcome.
Conversation between doctor and patient's attendant. Relative.
Doctor, what is wrong with my mother?
She has typhoid. I want you to monitor her temperature.
How often should I check her temperature?
Once every 4 hours.
What diet should I give her?
Only liquid diet.
When should I bring her for the review?
After 3 days.
Conversation between an anxious patient and a doctor. Before an operation.
Is the surgery a major one?
Yes, it is.
How long will it take?
1 or 2 hours.
Will I be given a local or general anesthetic?
General.
Will there be any after effects?
Except for weakness and a little nausea. You'll be fine.
Will it be painful afterwards?
Yes. But don't worry. You will be given painkillers.
Thank you, doctor.
Don't worry. You will be fine.
Conversation between a doctor and a patient. At an optic clinic.
Good morning. How can I help you today?
Hi. I'm here for my checkup. I've been experiencing blurry vision lately.
I see. Can you tell me more about your symptoms? When did they start?
It started about a week ago. I've been having trouble reading and seeing things clearly.
Okay. Let's start with a basic eye exam. Please read the letters on the chart in front of you.
Sure. E, F, P, T, O, C.
Great. Now, let's check your eye pressure. Please look straight ahead and don't blink.
Okay.
Your eye pressure is normal.
That's good to hear.
Everything looks fine. However, I would like to run some more tests to determine the root cause of your blurry vision. We may need to dilate your pupils to get a better view of your retina.
Okay. What do I need to do?
You don't need to do anything. I'll put some drops in your eyes that will dilate your pupils. It will take about 20 minutes for the drops to take effect. During this time, your vision may be blurry, and your eyes may be sensitive to light.
All right.
After the drops take effect, we will take another look at your eyes and perform some more tests. Based on the results, we'll determine the best course of action.
Sounds good.
Conversation between a dentist and a patient. At a dental clinic.
Hello, doctor.
Good morning, Sam. How are you doing today?
I'm okay. I've been having some gum pain recently.
Well, we'll take a look. Please recline and open your mouth. That's good.
How does it look?
Well, there is some inflammation of the gums. I think we should also do a new set of x-rays.
Why do you say that? Is something wrong?
No. It's just standard procedure every year. It looks like you may have a few cavities as well.
That's not good news.
There are just 2. And they look superficial.
I hope so.
We need to take x-rays to identify tooth decay and make sure that there isn't any between the teeth.
I see.
Here, put on this protective apron.
Okay.
Things look good. I don't see any evidence of further decay.
That's great.
Yes. I'll just get these 2 fillings drilled and taken care of. And then we'll get your teeth cleaned.
Thank you.
Conversation between an otorhinolaryngologist and a patient.
Hello. How can I help you today?
Hi. I have been experiencing a lot of pain in my ear for the past few days.
I see. Can you describe the pain? Is it a sharp pain? Or a dull ache?
It's a sharp pain. And it's been getting worse.
Okay. Have you noticed any discharge from your ear?
No. There hasn't been any discharge.
All right. It sounds like you might have an ear infection. I'll take a look and see what's going on.
Okay. Thank you.
It looks like you have an infection in your middle ear. This is a common cause of ear pain. I'm going to prescribe some antibiotics to help clear up the infection. You should start feeling better in a few days.
Thank you, doctor. I appreciate your help.
You are welcome. If you have any other questions or concerns, don't hesitate to give me a call.
Sure. Thank you.
Conversation between a doctor and a mother at a pediatric clinic.
Good morning. What's wrong?
Hi. My child has been coughing and has a fever.
I see. How long has this been going on?
It has been about 3 days now.
Okay. Let us take a look. It seems like your child has a cold. I recommend that you give your child plenty of fluids and rest. You can also give him acetaminophen to help with the fever. If the symptoms persist, please come back and see me.
Thank you, doctor.
You are welcome. Take care.
Conversation between a dermatologist and a patient at a dermatology clinic.
Good morning. What brings you in today?
Hi. I have a rash on my arm. That has been bothering me for a few days.
I see. Let's take a look. It looks like you have a mild case of eczema. Have you been using any new soaps or lotions lately?
No. I haven't changed anything in my routine.
Okay. I'm going to prescribe a topical cream. That should help clear up the rash. You should also avoid scratching the area, as that can make it worse.
Thank you, doctor. Is there anything else I should do?
Yes. I recommend that you keep the area clean and dry. If the rash doesn't improve after a week or so, please come back and see me.
Okay, I will. Thank you for your help.
You are welcome. Take care.
Conversation between a doctor and a pregnant woman at an obstetrics and gynecology clinic.
Hello. How are you feeling today?
I am doing well. Thank you.
Great. So, how far along are you?
I am about 20 weeks pregnant.
Okay. Let's take a look. Everything seems to be going well so far. Have you been experiencing any discomfort or pain?
No. Not really. Just some occasional cramping.
That's normal at this stage. Have you been taking your prenatal vitamins?
Yes. I have.
Excellent. Do you have any questions or concerns?
Not at the moment. But I will be sure to let you know if anything comes up.
Sounds good. We'll see you again in a few weeks for your next checkup.
Yes. Thank you.
Conversation at a nutrition clinic.
Hello. How can I help you today?
Hi. I'm here to get some advice on my diet.
Sure. I'd be happy to help. Can you tell me a little bit about your current diet?
I eat a lot of fast food and processed snacks. I know it's not healthy, but I don't have a lot of time to cook.
I understand. Eating a balanced diet can be challenging, especially when you are busy. But it's important to make sure you're getting all the nutrients your body needs. Let's start by talking about some healthy alternatives to fast food.
Okay. That sounds good.
Instead of burgers and fries, try grilled chicken or fish with a side of vegetables. You can also try making your own sandwiches with whole grain bread and fresh ingredients. For snacks, try fresh fruit or nuts instead of chips and candy.
Those are great suggestions. I'll definitely try them out.
Great. And remember, it's okay to indulge in your favorite foods every once in a while. The key is moderation.
Thanks. I appreciate your help.
You're welcome. Let me know if you have any other questions.
Will do. Thanks again.
Take care.